Hi everyone, welcome to our first lecture. As you can see, there are subtitles for your viewing if you need them due to sound or hearing issues. Keep in mind that they might not be as accurate as that I am speaking. So, today's topics, we are going over what is self-care, history of self-care, and Maslow's hierarchy of needs. So first I want to start off with what is self-care. So self-care defined is really taking time to focus on who you are as an individual, what you need, and committing time to yourself to be happy, healthy, and fully present in your life. When you aren't practicing self-care, it might look like you're living a life you don't even recognize. There might not be any time for peers. You might be feeling burnt out. You can be so stuck and deep in that type of mindset that you struggle to even see what's wrong. So self-reflection is huge and critical in identifying what you need more of in your self-care routine. What self-care is not is simple, quick fixes such as shopping or a skincare routine and impulse, anything really that involves impulsivity. Some of these things can be a self-care activity, but those are short, feel-good activities, right? So they might be part of your routine, but does not make up an entire picture of self-care. Self-care is much, much deeper than those items, than just focusing on one of those individual items. Self-care is also not things you might hear of, that have like negative type of that can have negative type of outcomes from. So like, for example, you finished a really hard semester and so you're like, you know what, I'm gonna go out celebrating with friends. So self-care is, time to relax, be with friends, but you end up drinking a ton of alcohol. Now, that's not typical self-care, right? Because this isn't good for your overall health. And alcohol is actually a depressant on your body, so you can actually feel, worse. So, activities such as drinking or drugs, things like that can actually be counter to your self-care. So for my own sharing, I am a licensed marriage and family therapist, as I think I shared earlier. And I started my self-care journey after I'd already become a therapist. So I was working with children who have experienced a significant amount of trauma, and I was working with them while they were in the foster care system. And so my job was very taxing in terms of I was driving all over LA County through the day, in our wonderful, beautiful traffic, and to be doing sessions within their homes. So I had to fight for these kiddos in court and for their rights and in schools. And I had to also witness even more trauma that they had experienced while being in the system. And so it was very taxing. And I came to a point where that mixed with my own life experiences, in relationships and healthy ones at that, in my 20s, that it just brought me to a point where it was like, I either take care of myself or I'm going to crumble. I'm not going to be able to be a good therapist at that point. And looking back, I still feel like I did great work with my clients at the time, but I wonder now where I now have a lot more self-care elements down and just thinking about what type of impact I can now have onto people. So that's what makes this really a passionate topic for me to teach about. Self-care is critical to our well-being. Self-care is really taking care of every single element of our being. And so I'm a strong believer in it. And even if you have an incredible self-care routine down, I want to still make it known that you can still experience depression. You can still experience anxiety. You can still be having to, work through trauma and work through a healing, phase of your life. And you could still experience unhealthy relationships or periods where you are strong on your self-care routine and then you kind of break down. And so that's where I really preach self-reflection, because it's kind of about taking a moment to sit back and go, wait, pause, what do I need right now? I've noticed these past few weeks, I'm not wanting to get out of bed, I'm sleeping more, not calling friends to hang out. What's going on? What do I need here? And so that's where I find self-reflection to be critical in our self-care routine. So self-care isn't all rainbows and butterflies. It can be the harder, deeper work, and that can be seeing a therapist. That can be going to self-help groups or reading self-help books. It can be sometimes really working on our authenticity as a person, putting up boundaries with people that we need to, even if it's a parent, just really putting kind of ourselves first in our own lives, even if you're a helper. So we're going to go into all of those domains of self-care through this course and really take a deeper look at what self-care really looks like. And so first today, I want to go over some of the history of self-care, and then we'll kind of go into the Maslow's hierarchy of needs, and then we'll be done for the day. So the start of self-care was a medical concept. So, it was encouraging healthy habits by doctors. So, that promoted good health for an identified condition. So this kind of explains maybe elderly patients that were in long-term care, clients who were diagnosed maybe with cancer, patients who were mentally ill. So it was really encouraging patients under doctors' care, things that would help their diagnosis, such as, improving nutrition or improving their, movement of the body. And then it kind of started to go into more of self-care we started to see it with trauma therapists and social workers and EMTs. And so it became evident that we can't really take on this type of role without first taking care of ourselves. And just to explain that a little bit further is, even as, if you're a parent, it's challenging, or a teacher, let's say, it's hard to be there for someone else, fully present for someone else when you are not caring for yourself, when you are feeling a sense of burnout. And then we started to see the self-care come up in the women's movement and civil rights movement. So women and people of color viewed controlling their health as a corrective to the failures of a white patriarchal medical system to properly tend to their needs. So self-care was a claiming of autonomy over the body, as a political act against institutional, very racist and sexist medicine at the time. And so this really was a time for women, a time for people of color to be fighting for and advocating for their wellness, their health, that wasn't studied, the differences for them in our medicine and in proper treatment as well. And then cultural factors came into play. So they impacted access to medical care. They still do, right? So one example is poverty. So activists have seen that poverty was correlated with poor health, right? So they argued that in order to dismantle hierarchies based upon race, gender, class, and sexual orientation, those groups must be able to live healthy lives. So in turn, living healthily required the involvement of individuals and communities in their own health promotion. So it meant that people had to start advocating for their health and for having better health in order to move up or get rid of, dismantle the hierarchy that we see in our society. We started to see women clinics open, and these were to treat low SES, social economic status, with unbiased care and to care for women's reproductive rights. So, example today is Planned Parenthood that we see today, right? So this is part of self-care. So Martin Luther King once said, of all forms of inequality, injustice in health is one of the most shocking and the most inhuman. So I just find that to be a very powerful and very true concept that still lives today, unfortunately. We still see inequality. We still see injustice in our healthcare system. And it's definitely inhumane. We started to see nationwide clinics to treat people of color open up. So programs started to be created that included social service programs and programs to aid coping against harassment and surveillance from police and federal government. These programs were especially important for women of color. So these programs have recruited nurses, doctors, and students for illness, disease, and prevention. And we still see these today. And then there became the wonderful wellness trend. So people started to realize that traditional Western medicine was failing to address the full needs of the patient, right? And I still think we see this today. I know for myself, being in the mental health field, and when I go see my, let's say, Kaiser doctor, my general family doctor, they really, they don't have, they're unable to have a really deep skill set in each sort of field and understanding each culture to understanding each cultural needs, right? They try their best. They're wonderful doctors, but our traditional Western medicine, when you're taught in medical school, is only so much, right? It's not the whole holistic picture of the body. And so that started to get very popular in the late 70s, 80s, where, white people started to see it to be kind of, you started to see yoga be trendy, right? And it's been really important the last few years, and I would say for all years, but even we're seeing it more in yoga studios nowadays, is that it's bringing it back to what the purpose of yoga is and kind of dismantling it from just this Western idea of it being like this great workout, right, for white women. And so it's taking it back to more of the spiritual element of it and in reclaiming your connection to your body, to your spirit, to your mind, to your breath. And so so here's a YouTube video. Let's see if it'll open for you.
There's a word you don't hear every day. It means exactly what you might think it means. The opposite
This is from
of
1979,
illness.
by the way.
It's a movement that is catching on all over the country among doctors, nurses, and others concerned with medical care. Wellness is really the ultimate in something called self-care, in which patients are taught to diagnose common illnesses and, where possible, to treat themselves. More than that, it is a positive approach to health, what one doctor calls recognizing that health is not simply the absence of disease. Is Teresa Rose. She's a former nurse who turned to self-care after suffering for years with painful muscle inflammation. Unable to find a cure with regular doctors and specialists, Teresa gave up traditional medicine and entered a program of self-care known as wellness. This is a new and developing concept that takes self-care to its farthest point. Noted for his work in this field, Dr. John Travis established a wellness program soon after finishing medical studies at Tufts and Johns Hopkins universities. Can you give me a definition of wellness?
It's recognizing that there's more to life than the absence of sickness. The health is simply not the absence of disease. It's an ongoing dynamic state of growth. Just because you aren't sick, you don't have any symptoms, and you could go get a checkup and get a clean bill of health, doesn't mean that you're well. It doesn't mean that you're going to prevent disease further down the line.
I had been in and out of the Cleveland Clinic. I had seen numerous specialists in various areas, and I just was so tired and so fed up being in so much pain. I would give you a ballpark figure of about $35,000 over the last 9 years in medical care.
Traditional medical care?
Yes, and had achieved nothing.
152, 3.
Giulio Esposti joined self-care for the same reasons. He's an executive with a major West Coast firm. For years, he suffered from constant headaches and physical pain. Doctors told him it was due to stress in his work. But any test or x-ray doctors administered to Giulio proved negative. Like Teresa, Giulio says he didn't find relief until he entered a program called wellness. Now, is what you're into a substitute practice of medicine?
No, absolutely not. It is an adjunct to and quite different from the practice of medicine. We don't treat, diagnose, or prescribe. Our role is to help the person discover why they're sick.
Travis does this by looking at a person's whole lifestyle, their diet, work habits, and physical activities. What solved Giulio's illness problems was biofeedback.
As the tone gets lower, you're warming, and you just raised your hand temperature 1 degree.
Biofeedback basically is an electronic device used to measure the amount of tension or stress in a person's body. After several sessions, Giulio learned not only how to relieve his pain, but also how to handle stressful situations at work.
I was getting headaches about 3 times a week.
This is before you started going to the wellness center.
That's true.
And how often do you have headaches now?
I guess I get about once a month now.
When you first started going to the wellness center, did you say to yourself, or did someone say to you, that's a crazy thing to do?
A few people in my life said, what is it? Have you checked out the credentials, and where were they educated, and, all of those sort of questions. However, at that point, I really felt that I had spent all those years going to your credentialed individuals. And so when I found someone who was willing to talk it out with me, that was pretty receptive to me. Not tell me what was wrong with me, but help me to find out myself.
Revived interest in self-care is reaching the health profession. Twice a year now, health professionals, surgeons, nurses, therapists, and others meet with Dr. Travis to learn methods of wellness which they can use for themselves as well as for their patients. Critics of the wellness movement particularly, they say, well, what would you expect in Marin County, California? It's another one of those kooky California. Why can't it? That's what the critics say to me, yes.
Well, I don't like labels, especially with all the latest publicity on cults in the San Francisco area. And I think that wellness as a concept doesn't need to have a culture or subculture added to it.
A doctor from Southern California, I'm talking about a physician, who's very critical of the wellness movement, said, Mr. Rather, what you're dealing with is a middle-class cult.
That's anti the whole concept of wellness, to follow blindly. We are not cheap, and the whole thing we're learning here is to take responsibility for ourselves, to question, and to use what fits for me.
And in wellness, you are the leader. You're your own guru, and you're the perfect person that is trying to make your life better and more full.
If more and more people become involved in wellness and indeed do take care of them,
All right, so although that video is now, 40-something years old, 43 years old, talking about wellness, they made a lot of great points, right? That it's about the whole being, that there's more to life than just correcting our physical disease, right? So, the ironic part, a lot of this wellness comes up with the topic of COVID, right? It's this we're, as a system.
Let's go!
I think the YouTube started playing.
You're gonna need grit to get through this. Nice, that energy I wanna see. That's what I love. Muscle Burns Fat is a high-intensity 3-week program that's designed to build muscle and lose fat. We are going to be lifting heavy. We have circuit training. We have very powerful movements in there. And the music is going to push you to that next level. Feel that beat. Feel that burn. It's all about gaining muscle, losing fat. That's what we're here for. Big sprint to the finish. You're next. Build muscle, burn fat, and yes. Let's go.
Sorry, guys. Bear with me. I am looking. There it is. It is still open. Oopsies. I knew I would do that. Okay. Sorry for the distraction. Okay. So what I was saying is about, the connection with COVID is, the CDC is very focused and, rightfully so for their position, being the center of disease control, right? It's focusing on us staying physically healthy. And, there have been a lot of also detrimental impacts from COVID for, sense of isolation, right? When we are unable to visit loved ones. There have been a significant increase in mental health issues. I know from where I work, we've seen a significant amount of increase in suicidal thoughts, right? And hospitalizations for it. And so wellness is significantly important right now. And, self-care is really in just the state of the world that we're in right now. But moving back we're going to go back to the 80s for just a minute. We started to see this shift in increasing of holistic approach to medical treatment. And this continued through the 80s and the 90s. And, we're seeing it a lot more today. I know for myself and for a lot of peers I'm around, holistic health is major. I'm starting to even see now health insurance including more things, such as acupuncture, which is something that it's not always covered, don't get me wrong, but it is becoming more covered by insurance. Mental health, it's still not perfect, but it's becoming more covered by insurance. And so we're seeing improvement. There's definitely ways to go. We also can't get prescriptions for supplements or, things that could better our body, things we can try before antidepressants, such as, different types of holistic type of nutrients of feeding our brain and our body with before we try, a medicine, a psychotropic medication, right? And so those unfortunately are not covered. And so I will go a little bit into that with the hierarchy of needs or just really in the hierarchy of our society where, access to those items and access to knowledge about what can benefit us for our nutrition starts to become a class thing, right? When it's not covered by our insurance. So back to the history. So we started to see that 9/11 had an influence even on the self-care because there became an increased research on PTSD and also indirect experiences causing trauma symptoms. So this is when we started to see more research on people who didn't directly experience the trauma of being, at the Twin Towers or being a firefighter in it or having a loved one die in that, horrific, time. But talking about the people who watched the planes hit the buildings on TV, watching the people jump out of the buildings, watching people be rescued from the rubble or not rescued. And so that's called, an indirect trauma. And so there became a lot more research on that. Then the wonderful influence of the internet. So this can go both ways. This has been very beneficial to self-care, that we now have community platforms online that connects us to more people where we might be part of a subgroup, or we might live somewhere where there's not a lot of people like us. And so because of that, we have this, so this person might feel isolated in that. And so now that we open the door with the internet, we can have a bigger door to more people just like us to talk with and to feel like, wow, I'm not so weird, or wow, I'm not, an alien, right? I'm just like these other people. And so that can feel very, comforting. And so that can include for women, people of color, definitely people of the LGBTQ communities. They now had a forum for sharing and support. Self-care has become more critical than ever. And like I mentioned, that, we're seeing that with COVID. I started teaching this course before COVID happened, and I was saying the same thing, like, the self-care has become more important than ever. And then, ironically, COVID hit, a year later. So there's a lot of stress going on in the world. And I would say it's more important than ever to really care for the self when there's just so many things going around us. All right. So here we are on Maslow's hierarchy of needs. And so something that I just discovered is a lot of Maslow's concepts and a lot of his studies were actually inspired by the Blackfoot tribe, and he spent some time with them, and that is where he grabs a lot of his concepts. So I just want to make that part known, just for his for recognition for the tribe, and not just giving all of the credit to Maslow. So if you haven't taken a psychology class, this might be new to you. If you have, maybe I can bring up new points for you. So really, when we start at the bottom of the pyramid, we see physiological needs, right? We need these needs to be met first, our physiological ones, which is breathing, right? We need air, we need water, we need food, we need a place to sleep, we need sleep, clothing, and reproduction, right, to continue. So we need those things, basic core things, in order to get to the next level of the pyramid, which is safety needs. And so then that moves into our sense of personal security, employment, having income, right? And then resources, health, and property. And so to make it a point, we can't have safety before we have our physiological needs met. And so in order to once we have our safety needs met, we can move up the pyramid to have love and belonging. And that includes friendship, intimacy, family, sense of connection. Once we can, have some of those items, we can move up the pyramid to esteem, which includes respect, self-esteem, status, recognition, strength, and freedom. And then moving up from there, that's when we can really get to true self-actualization, and that's really the desire to become the most that one can be. So it really takes all of those items to really get to a place to be able to have self-actualization. Can I say that you can have sexualization without, let's say, safety needs? Absolutely. If you live somewhere in a war zone, can you have self-actualization? Yes. Is it a lot harder for someone in a war zone to have self-actualization? Absolutely. Compared to someone of middle class, right? Living in America. And so, yes, typically you'll see that this is a step by step, moving up the ladder type of hierarchy of needs, really. But, you could grab some things from different levels. It's just going to be a lot more challenging for you. And so that goes with culture, right? That it's going to be a lot harder for you to feel safe if you live somewhere that is high crime, that is low socioeconomic status. And so it will be more challenging for you to get to esteem, to focus on that, right? And to focus on self-actualization. And so a lot of culture, a lot of, hierarchical societal concepts come into play with this. And so to keeping that into mind, this also comes into the concepts of privilege, right? And so the more privilege you have, the more easily accessible it is to get to self-actualization. Will you get self-actualization because you have all of these wonderful privileges? No. That still would take a lot of self-growth. And so I know for myself, I feel like I'm in a place of self-actualization where I'm now in a place where my career, where it's established, and I'm not in school anymore. I'm not trying to become a licensed therapist. I'm not studying. I'm not trying to build up the ladder. I'm at a good place, and even socioeconomically. And so now that I have all of that figured out, now that I have healthy relationships and I feel this higher esteem for, myself, and I'm at this place now of like, okay, what do I most want for myself now, right? That I have a lot of these other items, completed, and which is a great place to be. However, there's challenges within that as well. And if you're really looking for self-actualization, it can be kind of painful too. Okay, let's move on. So the last topic I wanted to go over is, why do we fail at taking care of the self, right? I mean, I've made all of these. I'll call them excuses, but they're also realistic items as well. So money, time, guilt, energy are all realistic reasons that could prevent us from engaging in self-care. They also can be just excuses. So money. There have been times in my life where no, I did not have money to see a therapist if I needed one. No, I did not have money to get a massage or get a gym membership or have enough gas to drive to the beach where, it helps me feel revived and replenished as a person. So money definitely does play a role in self-care. When you have more money, you have more access to a lot more self-care items and a lot more resources, right? But money, there are so many different things that's in self-care that you don't need money for. And so those are the items you are going to get from this class, which is wonderful. And time, we're all busy, especially if you live in Southern California, right? A lot of you guys work and go to school. And are taking tests for grad school, or trying to figure out what's next, and taking care of loved ones. So it can, adult learners, right, can have families, and so time's hard. Time is always going to be hard. The thing is about time is, if we don't take care of ourselves, everything else is going to feel harder and less enjoyable. And so taking that day just to recover from work, taking a day to just be like, you know what, I know I have so much to do, but I need this. It's kind of like charging our phones, it's plugging us back in order to get more energy. So that's the kind of ironic part, right? The more time we really do take for ourselves, the more productive we can be at the other stuff that takes our time. So it's 1,000% okay to take a break when you're in finals. You need it. And it's 1,000% okay to take that time to sleep because you need it. Then there's guilt. So I'm a mom of 2, and so I can have mom guilt, right? And so it's something to balance and letting myself know, right? Like, I can take this time for myself. I'm a working mom, so when I'm off of work, I want to spend all of my time with my children. When I take time for myself, guilt starts to sit in. I'm starting to think, gosh, like I was away from my kids all these hours from working, and now I'm taking time for myself. And I would say my first few years of my children's lives, I didn't take any time for myself, but I was unhealthy. And so that builds up, and your kids see that. And so I've come to this point where my kids now get the best version of me when I'm with them. Not always, I'm not perfect, right? But they get a better version of me when I take care of myself. They also are getting a great example from their mama that of a person who takes care of themselves. And so I do I've created a space at the house to get my daily movement in, you know, and to exercise. And I love exercising. I love to feel strong. And so they're into exercise now. And my 6-year-old threw a tantrum because she was telling me, you know, the 2-pound weights she literally said, I want to lift heavier. So she's getting upset because she wants to, you know, feel stronger too. So I wasn't letting her use them because, you know, I don't want her to smush a toe. So, you know, these are great examples we can set for others by taking time for ourselves. And it's, you know, having self-guilt to take care of yourself, really, it's only hurting you. It's unnecessary. And then there's energy. Sometimes, let's say, we might almost pack too much self-care on us, which is the opposite of beneficial self-care. So we might be like, okay, after school or after work, I'm going to go to the gym, or I'm going to wake up at 5 a.m. and I'm going to go work out at the gym, right? You can burn yourself out even when you're doing too much of self-care. And I've definitely have done that. I did that at the beginning of this year, where I was doing too much of self-care, mixed with my job. And so I was putting too much on the day, and then it drained me. And so my self-care then had to go into, okay, less writing, less teaching, less exercise, or like less social time. It became more of like, I need more rest. And so sometimes you'll just have to, you'll have to balance what you have time for in your self-care routine, and really allowing yourself to be like, all right, you know, I didn't get everything done. That's cool. Whatever, right? So energy is a true component that gets us, you know, out of sync with our self-care. But we get more energy from doing the self-care. And so moving our body daily really does give us more energy. But so does rest. Sleep is one of the most important ways to get our energy. So that is that for our first lecture. So I hope you enjoyed it, and thanks for listening. Bye, guys.